So what do you actually do yourself to stay calm?
If you're going to be able to do your job effectively and accomplish whatever task that you have before you, and also, especially when you have, you're a leader and you have to be able to effectively manage.
So what does doing compliance right actually look like in practice?
One thing I would say is that as far as Medicaid, I mean, obviously you don't want to incur the wrath of any state or federal authorities that have oversight over you, because they can make your life very difficult. But also, Medicaid, it is a partnership of the federal government and the state government. You do need to make sure that everything that you're doing.
So when you walk into a struggling operation, what are the first things you look at?
Before I make any kind of decisions, I want to be where I'm there as much as possible, firsthand, and actually observing what's going on, and but then also talking to my staff, including, of course, like the manager, supervisors, etc. But then also the rank and file staff that are doing the eligibility and the clerical sort of thing. And so
any kind of healthcare and medical facilities that at that
Yes.
particular time span.
Hospitals, skilled nursing facilities or nursing homes, assisted living, just regular doctor's office, all kinds of extraordinary situations, including social distancing and wearing masks, and dealing with making sure that everybody has been vaccinated. I know my mom was in a nursing home for most of the COVID era stuff, until she passed away.
Why do some teams thrive under pressure while others feel apart? Is it talent? Is it experience? Or is it something very deeper? Because when things get difficult, people often blame the team. But what if the real problem isn't the people? What if it's the system they are working in? And more importantly, the trust behind it. Trust between leaders and teams. Trust in decisions. Trust in the process. Today's guest has spent nearly 3 decades leading within one of the most complex public service systems in the world, learning firsthand what makes people, teams, and organizations succeed under pressure. In this conversation, we'll explore leadership, trust, accountability, and the systems that shape them. Welcome to the Empire Global Talks. I'm your host Pooja, and joining us today is Thomas Stedham. Let's dive in. Yes, so beginning with the questions. Um, you've spent nearly 3 decades inside the Medicaid, and what drew you to the field and what kept you committed to it?
Yes. Now I started at the beginning. I mean, of course, I needed a job, and I needed, paycheck and health insurance, etc. But also, um, I liked the way that I was able to do something that was going to be helping people, helping individuals that needed assistance with their medical needs, but then also helping providers get paid. And I started out as an entry level eligibility worker, and over time I was able to rise up through the ranks, and there was a lot of opportunity there, a lot of professional development, and of course it was also a lot of challenges there. And uh, I met a lot of good people along the way, developed some very strong friendships, a very strong network. So that was something that definitely kept me engaged. And as I stayed through my career, and you've kind of touched on this already, I did bump into certain things that made me look at the Medicaid system through the kind of systems thinking kind of analysis. So the way that Medicaid works is one thing to say that the program, the intentions of the program are to accomplish X, Y, and Z. But regardless of whatever the intentions are for a government program, or any kind of thing you do in life, it's not that the intentions don't make any difference, but that you have to look at, what are the incentives, and the Medicaid system incentivizes certain kinds of behavior. So that's the kind of behavior that you're going to get. And that's one of the things that I've talked about in my book, Medicaid Made Simple, that's about to be published.
When did you realize that leadership is about people, not just policies? Was there a moment where you thought that there's something deeper going on in this field and that you need to explore that part and bring light, enlighten people who are beyond this field and also in the field?
Um, sure. I would say that, kind of going back to, my previous answer is that, you have to look at the way that the system works and what kind of incentives that it gives people. And so, over the, about 29 and a half years that I worked for Medicaid, I was able to see how, different people could be faced, different Medicaid eligibility staff, or for that matter, people working in other parts of the agency, they could encounter similar situations and come up with different results. So it's not just the policy, because policy can never perfectly anticipate life. We live in a very complex world, and whatever policies that you have regarding Medicaid, or for that matter, any kind of policies, inside or outside of government, it's like there's always going to be a certain amount of discretion and judgment that's involved. Like, okay, how do I, or how do my staff, if you're some kind of supervisor, how does your staff apply a particular policy to a particular situation? So, like I said, there's always a certain amount of discretion and judgment that's involved. It's kind of like, if you're a judge sitting on the court, different judges, they're all trying to apply the same law in theory, but there's a certain amount of discretion and judgment and different ways of interpreting it. So you're not going to get some kind of uniform outcome like people working a calculus problem.
You rightly said it. There are going to be different interpretations to the policies. There are going to be different loopholes and different mindsets to what carries a policy to people and situations. Yeah, so at some point, your thinking looks like have been shifted from focusing on people-centric to focusing on the systems. So what was the trigger, and what did you find something very intriguing to, look into the systems more deeper? So we would like to hear about that.
Sure. I would say it was especially once I became a supervisor. At one point I was a supervisor over a district office, and I had about, at any given time, about 30 people underneath me, including 3 supervisors. And then eventually I became an associate director, where I had 2 different district office managers under me, as well as multiple supervisors and multiple eligibility workers and clerical staff, et cetera. And so, and you deal with, there's some things that you're dealing with that's not just about Medicaid eligibility. For example, there's always chronic problems, or much of the time you would have problems with understaffing. Sometimes you could have multiple vacancies, and that really has nothing to do with Medicaid policy per se. That's just the reality of managing a workforce. And then of course we also starting in 2020 2023, when I had gone from a certain sector of Medicaid I was working in, medical and quality review. Then I came back to eligibility, and of course that was right during the middle of all of the and you see how at the federal and the state level, there were a lot of changes that were made to try to deal with, the extraordinary circumstances involved in all of this public health epidemic. So both the federal and state governments, we were having to, come up with new ideas of, how to deal with this very unique, probably once in a career sort of extraordinary circumstances. So Again, you have to look at how do you deal with personnel shortages, and of course, you always have a lot of people when they come in and they're starting to be in eligibility to work for the first time, or maybe they get promoted up to a certain position. There's always going to be a certain amount of a learning curve that they go through. So, I try to think, what can I do, or what can, the supervisors underneath me, what can they do to try to help deal with, personnel shortages, or getting people trained, and, dealing with all of these different operational factors that you're having to face, which don't have anything to do directly with policy rules. So, this whole thing about, the system and how does the system work. I think when I became a supervisor, that was where I got the greatest exposure to events that pushed me in that sort of thinking.
So I'm sure this the pandemic showed you a very different side of this field, and I'm sure systems at that time would have been, in place, would have been a virtue for any kind of healthcare and medical facilities at that
Yes.
particular time span.
Right. Hospitals, skilled nursing facilities or nursing homes, assisted living, just regular doctor's office, with all kinds of extraordinary situations, including, social distancing, and wearing masks, and, dealing with, making sure that everybody has been vaccinated. I know my mom was in a nursing home for, most of the COVID era stuff, until she passed away. And it was like, every time my sister or I would, go to visit her, you had to sign in, and they would ask you all these questions about, have you been vaccinated and so forth. So that was,
Right.
that was a pretty extraordinary sort of thing to deal with. And I would also say, as far as COVID-19, of course, there was a period of, several years where the eligibility rules they were made greatly more lenient for a temporary time. For example, we were not allowed to terminate anyone for Medicaid in Alabama. And, I'm sure this was similar throughout the United States, because this was coming from the federal government. It's like, unless the Medicaid recipient died, or they moved out of Alabama, or they asked us specifically, please terminate my Medicaid, that, we were not terminating the Medicaid. So, of course, in Alabama, that led to somewhere between an extra 200,000 to 300,000 Medicaid recipients being on the system, as would have been under the old rules. And then, after that had been in place for a few years, we eventually had to go in what the federal government called an unwinding process. For example, most of the Medicaid programs that we do, the recipients or their sponsors had to have a review of their eligibility at least once every 12 months. That's a federal requirement. But we suspended that. But then eventually we had to go back to where, like, okay, you do have to have a review every 12 months. And if you don't do it within a certain amount of time after it's due, then you could lose your eligibility. And we did start terminating people once again, like if their income was too much, or their resources. So, that was something that stretched out over several years. And so, again, you can kind of see, you're dealing with not just the eligibility policy itself, but also you're dealing with, this very complex system. Because the rules for Medicaid, it has to be something that, as closely as possible, it can be applied uniformly across, every person who applies for that program. Is it, you're not supposed to come across as making decisions that are, as the judges would say, arbitrary and capricious. Every decision that is made at the eligibility level is where that could go to an appeal. It could end up in a hearing. So, you're dealing with a lot of operational things such as that.
So standardization was a part of the system, which was like mandatorily had to be done due to the tough times everyone was going through at that time. And
Yes,
like you
ma'am.
mentioned about, as you're dealing with a lot of hierarchical levels, within the organization or maybe outside with someone, what do you think that what makes you and what helps you stay calm even when everything is feeling very urgent, like how it was in the pandemic. Apart from that too, so what do you actually do yourself to stay calm?
There's a lot of different things. One thing I believe in very strongly is uh, if you're going to be able to do your job effectively and accomplish whatever task that you have before you, and also especially when you have, you're a leader and you have to be able to effectively manage. And also, uh, I think if you come across as frazzled or, oh, I can't handle this, I think, you give off a certain kind of energy or vibe, and, people can see that, people can sense that, and it can be kind of contagious. So you need to be very careful as a leader, not to be a negative influence in that way. So, I would make sure as much as possible, take my 15-minute break in the morning, take my 15-minute break in the afternoon, and, make sure that I took my 30-minute lunch. And then, friendships are very important. Like when I would go on break, as much as possible, I enjoyed going on breaks with, some of the people that I was friends with. So you could kind of have a little bit of camaraderie and, have a laugh or two. And of course, I tried to be very careful about monitoring, like, okay, my self-talk, like, okay, what sort of inner monologue am I having? Like, oh my goodness, this is terrible. I'm not going to be able to handle it. You have to be careful, or you can, create a self-fulfilling prophecy like that. And if it was ever where, I needed help or I needed some kind of insight, I mean, I would try to accomplish everything with as little supervision as possible. Sometimes you're going to have to ask for help from the people above you, but also I had a very open door policy as far as any of my employees, regardless of level. It's like, I would be in frequent contact with them, okay, you kind of keep your, ears to the ground, as the saying goes. And, is there any sort of thing that they need from me? Is there any way that I can help? And then also, if my employees were where, if they just needed somebody to listen, or they needed somebody to just, I need to just vent, I try to do that. So you're kind of juggling all these different things as far as yourself and your staff. So, and also it's like, when it's time to leave for the day, go home and put everything kind of, pause it until it's time for you to come in again. And, make sure that you're keeping yourself, well-rounded, like, spending time with, family, listening to good music, reading, talking on the phone with friends and family, going to regular worship services. So you want to kind of keep yourself well-rounded and, not just be consumed by the energy of work, which can absorb all your energy if you're not careful.
Right. So being centered is like one of the most important characteristic of being in the field of medical. I'm
Yes.
sure that is one challenging task on a different level, I think.
Yes, ma'am.
So, how would you reframe compliance? So, what does doing compliance right actually look like in practice?
Well, one thing I would say is that as far as Medicaid, I mean, obviously you don't want to incur the wrath of any state or federal authorities that have oversight over you, because that they can make your life very difficult. But also, Medicaid, it is a partnership of the federal government and the state government, and this is these are billions with a B, billions of dollars that's spent on Medicaid every year. So if you're working in Medicaid in any sort of capacity, then you are a steward of taxpayer money. So you do need to make sure that everything that you're doing, you're giving an account, not just to the federal government but also to the taxpayers. Hey, we're being careful with this money and trying to make sure that it's spent according to state and federal law, the way they're supposed to
Right.
be. But
Right.
also, I would say it's hard to overstate how important documentation is. You want to make sure that you always got your documentation correct, and you don't need to be where you don't really think about documentation until there's some kind of an audit or some kind of report. You know, uh, being audit compliant and audit ready, that's something that should be done on a daily basis. You got to make that a task that every one of your employees is responsible for. And I know, for example, the eligibility workers, not just under me, but all of them are aware there's certain documentation that they were supposed to do every day, including like, which applications they took and, writing down the person's name and their Medicaid number and, different details about the case. And it's like, if you have all of that paperwork, which is, related to archives, then when it's time to gather up the archives and have them picked up and sent to the agency warehouse, if you kind
Right.
of do it a little bit at a time, then it's really not that difficult. So, you know, it's it's just something that you have to do every single day because you know that you're going to eventually have to do all this archiving. So do it every day, and it's really not that difficult. But if you neglect it, then it can really come back to bite you.
So I think it's more of a habit of compliance than the compliance actually, right? Because compliance cannot just start at the 11th hour, but it has to be in place at all times so that that 11th hour is not actually in
Yes,
picture.
ma'am. If you do it the way that we were always striving to do it, then it doesn't mean that you couldn't run into some kind of a problem or a roadblock, but it's going to make it about 90% easier to do it
Right.
right and efficiently and quickly if you're just, everybody, you're making sure that they're doing their daily archiving and all of that record and document
Right.
preparation. It's so
Definitely.
much easier. It's like you don't want to be where you've got a semester exam in college and it's like, well, you haven't really studied anything the entire semester, and then the night before you have your final, like, well, I guess I should start studying. Well, you're studying and giving everything its due diligence the entire semester, and then if you do that when you take the final, although it could still be challenging, it's like if you have all that consistent preparation, you've been laying the groundwork, it's going to be so much easier to do well if you do it that way.
Right, right, definitely. So, how does trust actually impact? How does the trust actually determine all the ground activities and the compliance and your systems?
Certainly, the clients, Medicaid clients and any providers that are involved, certainly they need to be where, they can trust us as far as being truthful and fair and even-handed and, dealing with every single application, impartially. But then also, when you're a supervisor, your staff needs to be where, they trust that you are doing everything according to what the policy is because it starts at the top. It's like if you're not carrying out your tasks the way that they're supposed to be, or people are not sure if you are, then it's going to give less incentive for the people under you to do things the way that they're supposed to be. Plus, to me, if someone is going to have confidence in you as a leader, then a very significant portion of that is you have to be where you're someone that can be trusted, that you have integrity and you're doing things the way that they're supposed to be. So it just, you know, if you don't have a certain amount of trust, whether it's from the public, the clients, the providers, or your staff, then that's going to undermine confidence in the system, and you know, that's in order for the system to effectively function. Trust is just an integral part of that.
Very true, definitely. So, when you walk into a struggling operation, what are the first things you look at?
Before I make any kind of decisions, I want to be where I'm there as much as possible firsthand and actually observing what's going on, and but then also talking to my staff, including, of course, like, the manager, supervisors, etc., but then also, the rank and file staff that are doing the eligibility and the clerical sort of thing. And so, I want to see how things are operating and have discussions with all the people, ask questions, and, be open to where my staff, can, ask me questions or confide in me, and then, you know, see how things are working. And then after I've done that sort of, reconnaissance of what's going on, and, possibly, kind of touching base with my supervisor, then you kind of come up with a game plan like, okay, what are we going to do to face these challenges? But also, I think it's hard to overstate how important morale is. And some leaders do not think that way, but I very much do. And it's like, if people, if they feel discouraged, hopeless, overwhelmed, I mean, that's just not going to, in addition to the fact that that's going to be pretty miserable for them, I don't think you're going to get your optimum kind of compliance out of them. So, I'm not saying that you should sugarcoat things or try to make it like, everything is, jolly and joyous like Mary Poppins. You have to
Right.
be able to deal with, the ugly realities sometime. But if you're an encouraging kind of positive person, and I'll tell you, one of the things that I like to do, I I got this habit from one of my supervisors. When I worked under him, it was like every single day he would go by every one of us, every single employee's office, and just say, hey, good morning. And, you know, I would do that. I would try to say good morning to all of my staff. And, it didn't necessarily have to be something that was lengthy, but, if they had, questions, it's like, hey, good morning, you need my help. I think that helps create a positive work environment. And then, having celebrations for people's, for their birthday, various holidays, or celebrating new employees, or people who got a promotion, things like that. When you have a positive work environment like that, yeah, you still got to get the work done. But I do think that in addition to it being the only ethical way to treat people, which is to treat people the way you want to be treated, I also think that it's very much more conducive to people being able to do their work, and also to help reduce the number of people that are like, I just don't want to be here anymore. So you just have to go in and just be consistent in that area.
Right, right. You just this is going to stay with me for a really long time. Like how you said about just making somebody feel important and a part of an organization or a group is going to do wonders, because the field that you're working in is more of a service industry for the needy ones, or somebody need in terms of health, in terms of maybe physical and mental health. And I think you cannot pour from an empty jar. People
Right.
who are themselves fuller will be able to do a better job treating others, right?
One thing that I would add to that is that on the genius level of Nick Saban, who just a couple of years ago retired as the head football coach at the University of Alabama. But during the time that I was a leader, I very much wanted to be, at least in some respects, like Coach Saban when he was, at Alabama and the various places he coached. It was like, now I don't think I was as hard nosed as him. He could be very tough and demanding, and I don't think I was like that. But Coach Saban is an example of what I would call a player's coach. It's like guys, wanted to play for him. It's not that he wasn't going to, chew them out if they got it wrong. And and I didn't really chew people out. Again, I wasn't really stern like him, but it was like, there were people that he showed great appreciation for his players, like they were family. And it's like, again, it's not just, because you're trying to get people to like you out of some kind of a neediness or something, but it's like, again, in addition to it being, to me, the only way that you ought to treat people, compliant with the golden rule, it's like you have to deal with a lot of things as a workforce team. And it's like,
Correct.
if you have a players kind of coach that's steering the ship, so to speak, then,
Right.
you have more, you have a sense of loyalty and appreciation. And, people are more likely, I mean, of course, some people are going to leave, but people are less likely to want to leave. And they're also more likely to get better work done when they have
Correct.
someone that they want to work for. Because, everyone who's been in the workforce very long, you're going to run into some bosses that you find very unpleasant to work with. And, for whatever reason, some people are just like that. But my thing was, as long as you were doing your job and you were compliant with all the personnel rules and that sort of thing, it's like, hey, I was not going to try to micromanage you. I mean, sometimes you have to micromanage someone if their performance is really poor, and you got to go through that whole series of steps. But if you were doing your job right, then, I definitely had your back. And, if you ever sometimes you get pressure from above you, and then, people, they get that, then they lash out at the people below them. And it's like, I try not to do this. Like, no, I try to be like a firewall for my employees. So if I ever caught any, tension from above me, which is just a part of being a supervisor, I didn't think it was right to lash out at my people. So again, I wanted to be a players coach where, people wanted to work for me, and I tried to be the kind of supervisor that I would want to work for.
That is indeed very insightful, actually. All the industries look forward to people like you for choosing their leaders, for a
Well, thank
better
you.
workplace. So I
Thank
would
you.
like to come to the next question. So what do you do in the uncertain times? What does leadership during this uncertain times for you look like? How do you deal with it?
As far as dealing with uncertainty, you have to come, every day, kind of like in an added atmosphere of like, trying to be positive even under challenging circumstances. And then, you're researching information, meeting with, people above you, below you, whichever. And it's like, sometimes situations are where they're just kind of, constantly evolving. There's a lot of complex things going on. So you have to be where you might have to just go in like with a, one day at a time attitude, but then you try to learn as much as you can from various sources. And then, as needed, touch base with your supervisor and, see what's going on. But just, you have to be like in a constant learning kind of mode, like, okay, I don't know everything. I never will. And it's like just every day, what can I learn? And sometimes you may have to kind of use trial and error. And, if something doesn't work,
Correct.
okay, just, okay, we won't do that again. And if something does work, you stick with it. And sometimes you might can, find out information from your peers who are in similar positions. Like, okay, what are you doing about, X, Y, and Z? So you kind of have to be like even if you're a leader, you kind of have to be like a perennial student. You're always willing to learn, or you may have to change your ideas about something. And just because something worked at a certain time in a certain situation, it doesn't mean that it's always going to work, in the
Correct.
future for every situation. So you just have to be in that mode of just constant learning, and be kind of like a student slash, a research scientist, what's working and what's not.
Right. So during this phase of learning and unlearning so many things, how do you balance empathy and accountability at the same time? Because compliance is about accountability and systems is about accountability as well. So how do you balance both of these?
You have to walk a really fine line. Empathy is certainly important, as I've touched on in some of my, previous answers. But uh, I think if you, understand empathy in the correct way, then there's really not a conflict between empathy and accountability. Because, empathy, you can see what somebody's going through and you put yourself in their shoes and that sort of thing.
Right.
But to borrow from, my favorite childhood story, I love the story of, Goldilocks, like, this, this bed is too hot, this bed is too hard, and this bed is too soft, and this bed is just right. Well, you kind of have to do it like that. Like, if you're too lenient with your staff, then, that causes problems. Some people are
Definitely.
going to do the minimum that they can get away with, and that's true of any workforce. And so there have to be certain kind of minimum standards, like you're not going to tolerate regarding attendance, conduct, honesty, and people's work accuracy. When they're determining Medicaid eligibility or whatever, you've got to make sure that they're doing that because that's what they're getting paid to do. So it's just it's a constant balancing act. So if whatever task that I'm responsible for or my people are responsible for, I was always trying to be where we tried to do everything as correct as possible, as efficiently and quickly as possible. And so that's what people are paid to do, is to do that job. And so as long as
Right.
you're not mean to your staff or treating them in a way that you're not going to want to be treated, then there's not a conflict as far as I see with being good to your people, but at the same time we do have certain tasks and certain rules that we have to follow. So it's just something that you have to do one day at a time. And as far as any kind of employee disciplinary issues, of course you have to do that on a case by case basis. And it's like you don't necessarily just start out just trying to be punitive, but you're really not doing an employee a favor if you're not at the first sign of trouble trying to take some kind of positive corrective action. And you could frame it as that's a way of showing empathy for that employee. Is like if they have unchecked poor behavior or poor work performance or whatever, then if you don't try to do something to correct it, then there's a very good chance that eventually, they're going to face some kind of disciplinary action or possibly corrective action. And so, you're really not
Definitely.
doing them a favor. And even if they get away with it, with poor performance or acting badly while they work for me, there's a good chance that, they're going to be in some other kind of a position. And, eventually that's going to come back to be a real problem for them. So, you could frame it as being that, if you're helping someone do their job correctly and learn to be compliant with rules about behavior, attendance, and work accuracy, and et cetera, it's like you're helping make that employee, again, not just where you're shielding them or minimizing the chance that they're going to be in some kind of negative personnel action, but you also can help make them more mature and rounded person. And that's going to make them more valuable in the workforce, when they're being disciplined. And, again, going back, to Coach Saban, and, not saying that I'm on his level or anything, but it's like, the guys that played for Coach Saban, I mean, because they were used to, having to have these standards that, they knew that he was not going to tolerate them not doing their job in practice on the football field, that made them very attractive. A lot of these guys ended up going to play in the National Football League. So it's like, to me, you're actually helping that person. You can be helping them to grow both as a person and also professionally. And so to me, it can actually have positive consequences for them because you insisted firmly, but still diplomatically, like, no, you're going to have to follow the rules. It's like you're actually, in a way, helping them. And that is, to me, in a way, showing them empathy.
Right, definitely. So
Empathetic leaders build other empathetic leaders. That it's a chain, and then it's like a safe and secure working place, I'm sure.
Yes.
So, I'm pretty sure that your approach and mindset have made a real impact on both the system and the people within the system as well. So, what's one impact that you are most proud of?
I would say the thing that I was the most proud of was there were a number of people that worked for me that I saw rise up the ladder, in the chain under the Alabama Medicaid Agency, and you know, there were a couple of them that actually, got to a level of me. So, anytime you have someone, excuse me, that's working for you, and that, although, they should get the credit for the work that they did, and I'm not downplaying that, but if you know that you had a hand in helping them to be successful, and then you see that, they go on to become an associate director or director, that is very gratifying because, I was never somebody that, didn't want my people like, no, just keep staying in this position because it'll be difficult for me to replace you. It's like, no, it's like I was always, proud, kind of like, a proud father, hey, these are my subordinates and, they've risen up, they've become successful. That's always a very gratifying feeling.
That's indeed good to hear. Leaders like you are very much needed in
Well,
every
thank you.
organization, I must say. So, we are coming to the end of this podcast, and this is the last question I would like to ask you. What
Okay.
advice would you give to the emerging leaders? You've also written about this, like you mentioned earlier, to help people understand these invisible constraints. And where can people learn more about your work? Can you please mention about it?
Yes. Now, of course, I'm on LinkedIn, and it's, Thomas Stedham. And then now my website, which is one word, Tommy Stedham, TOMMYSTEDHAM.com. And, you can, contact me through either one. And I would say that, my book, Medicaid Made Simple, I'm supposed to receive a proof copy this week from Amazon. Then, of course, I got to real carefully and make sure, everything just right. And so, and then, once I go through all of that and I give Amazon the approval, then, maybe as soon as within the next week or two, that book is going to be available. I would mention that I also was a co-author of a book called The Success Playbook. And it was the primary author, his name is Ray Brehm, Brehm, but I am a contributing author to that. And that is available on Amazon right now. And I know when it first came out, it was going to be, at a, kind of a introductory price. So right now will be the great time to get it. I also wrote a book, I wrote a chapter for, there's a there's a company in North Carolina called Hope Books, HOPE, and there's a book that's coming out sometime this summer, and it's called The Courage to Say Yes. And I wrote a chapter in there on bullying, and bullying gets a lot of attention. It's a terrible thing, and I wrote a chapter in that book that was recalling an incident when I was, in about the sixth or seventh grade, and I was being bullied. So, you can see, like on LinkedIn and on my website, and then, these books that are either out or coming out, you can see, the different, you know, my different ideas about a number of things. But I would say, in my book, Medicaid Made Simple, I wanted it to be where anything to do about politics and religion, people get into serious arguments, and, you can see the programs in TV where, you've got a split screen and you've got people, where they're screaming at each other and, bickering. And it's like, I didn't want my book, Medicaid Made Simple. I didn't want the book to be like that. I wanted it to be as impartial and nonpartisan as I possibly would. Now, of course, I'm I am a fallible human being. I'm not perfect. And so it's not going to be perfect. There's no way you're going to have it without a certain amount of, it's influenced by your beliefs and your life experiences. But my goal was I wanted it to be where, anybody that's, a reasonably intelligent person could look at the book and understand, like, okay, this is how the system works, but then this is also why it works the way it does. And then I talk about, there's certain constraints and, there's always unintended consequences. As a matter of fact, chapter 2 talks all about that. And it's like, uh, I wanted people to understand that, there's always a certain amount of trade-offs. And, one of my favorite authors is Thomas Sowell, and he said, there are no solutions, only trade-offs. And it's kind of like some people have used this comparison. It's like if you've got like a sausage, you squeeze the sausage in one way. I'm sorry, you squeeze the sausage in one area, and then it kind of bulges out in the other. And I won't try to go into too much detail, but it's like there's always going to be unintended consequences, in programs like
Right.
Medicaid. So, now the book, it's roughly about 140 pages, including, all the references and stuff. So it's not that long of a read. And, it kind of goes into more detail than I could get into within the time constraints of this job, of this podcast. But I would say, as far as, any advice to emerging leaders, of course, as I mentioned, you want to be where you treat your people right. That's the golden rule: do unto others as you do unto yourself. But then you also need to take care of yourself. It's kind of like if you're on an airplane and it's like there's some kind of a crisis and the little oxygen mask come on, well, the first thing you're supposed to do is you put the oxygen mask on yourself so you can be able to help all the other people. And it's like, get get as much sleep as you possibly can, and stay connected to other people, get exercise, and for those who a very big part of a person's life. And I tell you that the most important thing in life, assuming that you've got your health and the bare minimum of physical safety, the most important thing in life is relationships. And just
Right.
make sure that you take care of yourself. Oh, and another thing I would say is hard to overstate the importance of documentation. There's various professions where they'll say something like, if you didn't write it down, it didn't happen. And anytime I was talking that had just got promoted to some kind of a supervisory position, I would tell them it's like, not saying that, everybody that you're going to work for is sinister or anything, but it's like, you need to protect yourself. You keep records of what
Definitely.
happened. And, when you have a conversation with your superiors or with your subordinates, it's like, it's not a bad idea to send an email afterward,
Right.
okay, like let's say I don't know, let's say you had an employee's name was Jeffrey, and he's got an issue with chronic tardiness, and so maybe you don't formally write him up, excuse me, but you do have a conversation like, okay, Jeffrey, you know you've been tardy 6 times in the past month, and it's like you're going to have to do something about that, or I'm the next time I'm going to have to write you up and there'll be a corrective action plan. Well, even though you didn't formally write him up then, it would be a great idea to just send Jeffrey an email, and maybe even depending on the circumstance, CC your supervisor. Jeffrey, this is to confirm that today we spoke about your tardiness and the fact that you've had 6 tardies in the last month, and it's like if this pattern continues, then there could be further progressive discipline or something like that. So that way, it's undeniable that you get that paper trail, because it's very good to have a paper trail. Not that you're necessarily just out to get somebody, but if you ever need to take any kind of corrective action, it's like you kind of have to think about it like going to court, because if you work for the government, then if someone ever gets to the point to where they're going to be suspended or possibly even terminated, then they have to have a hearing. So it's like, you kind of have to, think like a lawyer. So, protect yourself and, document everything, immediately and as accurately as possible. So that way, if there's ever any kind of an issue that comes up, well, it kind of going back to what I said about, studying for your semester exam, you don't wait till the last one. I'm going to have to
Right.
go talk to, I've got to go talk to the human resources director or maybe the deputy commissioner about this personnel issue. If you don't have all of your documentation lined up, then, you
Right.
look kind of dumb. But if you've got all
Right.
your ducks, if you've got all your ducks in a row, so to speak, then it's going to be, much better. And again, it's like you're actually not doing that employee a favor if you tolerate, poor attendance, poor work performance, etc. So, that, in a way is helping them. Because like, if you just talk to them, well, we just,
Right.
but you've got that email where, well, this is the email that, Tommy sent this email to Jeffrey, on, April the 20th, 2026 at, 9:15 a.m. Well, if you ever have to take any kind of further disciplinary action, it's very critical to be able to have those emails,
Right.
to document. And or if there's ever any dispute about, who said what to whom when, it's like, if you've got that email, then that gets rid of a lot of that ambiguity.
Right, right. There is no room for ambiguity at all then. So with this, we come to the end of the session, this podcast, and
Yep.
it has been truly a pleasure speaking with you, sir. I've got so many insightful, thoughts from you. Indeed, a kind of, a very different kind of leadership quality that you possess of being an empath and still being keeping systems and everything under control so very easily and with grace. So
Well, thank you, and I appreciate the opportunity to speak with you. And you've been a great host, and I think I've enjoyed it at least as much as you did. So I appreciate you letting me come on today.
thank you very much. So I really enjoyed speaking with you, and
You
I
too.
wish you the best with your book, and
Well,
I'm
thank you.
I'm surely going to read it. It's going to be a pleasure.
Okay, well, thank you. Hope you have a great rest of the day.
Thank you very much, sir. Same to you.